Hello, Dr. Desiree Stahl here, naturopathic physician. Thanks for joining me today on Keeping Health and Medicine Simplified. Today's discussion will be about topicals. What is on your skin? We discussed prior that it is really important to try and avoid environmental contaminants as much as possible. We talked about reading labels on food, but it's also important to read labels on the products that you put on your skin. So think about it. Quite often, I will prescribe hormones like progesterone and estrogen for women to put on their skin when they're deficient. Progesterone is a rather large molecule, but yet it absorbs through the skin, goes into the bloodstream, and I can see it on subsequent lab work when I check their levels. That's slightly concerning considering that most of the chemicals that are in the lotions that we use are smaller than progesterone. So that means that chemicals that are in your lotions absorb into your bloodstream and they contribute to overall toxic load in the system. So when I have patients come in who say, "Doc, I've really cleaned up my diet, but I'm still having brain fog and my hormones are still a mess," I start looking at, well, what are you putting on your skin? Sometimes it's obvious because I can smell it, but sometimes not so much. So then what we do is we find out, well, what are you using for lotion, for example? We look it up online and we start reading ingredients. And it's quite shocking how many chemicals that you quite frankly can't pronounce are in the lotions that you're putting on your skin. And how is that affecting your health? So for example, parabens in your products increase the shelf life. What they do is they prevent any bacteria or viruses or fungus from growing, so it prolongs the life of your product. So if there's something in your lotion that's preventing any other life form from surviving, it's probably not that great for you either. Phthalates, for example, are used to make a fragrance last longer. Phthalates are endocrine disruptors, just as parabens are, which is going to affect how your body processes, utilizes hormones, which can affect your hormone balance, women as well as men. Aluminum, for example, in deodorants, there's been concerns about it causing breast cancer in women, and the conclusion on that and the studies on that are not quite clear. But we do know that aluminum prevents you from sweating. It clogs up your sweat glands. That's why you don't smell. If something is preventing you from sweating and removing contaminants out of your system through your sweat, is that good for you? Probably not. It may or may not cause breast cancer, we don't know, but it's definitely preventing one of the ways that your body eliminates contaminants out of the system. Anti-aging lotions, for example, have estrogens in them. Unopposed estrogen in the female body is not necessarily always safe. When I give a woman bioidentical estrogen, I always pair with progesterone because estrogen and progesterone is the way that nature intended for them to be together. If you have estrogen by itself, that can present problems and increase your risk for female-type cancers. That is something that should not be ignored. So what do? You read your labels on your lotions. If you're reading the label and you're seeing a bunch of ingredients in there that you can't pronounce and that sound like chemicals, it's probably not good for you. So I always say to my patients, if you can't eat that lotion, it's probably not good for you to use. So what do? Well, there's a couple of options. You could go very pure, which is of course what I do. I use either cocoa butter. I will use jojoba oil, and I'll put a couple of drops of essential oil like lavender in there to make it smell nice. Another option would be for you to use glycerin if you have more oily skin. Glycerin is a little sticky if you use it in high doses, so you can buy vegetable glycerin, but you dilute it with water. You can maybe put essential oil in there. You can spray it on your skin for the moisturization. Another option is you can go online. The Environmental Working Group has a database where you can put in the product that you're using and it'll tell you how bad is it for you. That's called ewg.org for Environmental Working Group. You can check that out to see how your product rates. But again, even the Environmental Working Group, I like to use products that are even cleaner than that. So please pay attention to what you're putting on your skin. I find it quite shocking that there's women that come in that have had their uteruses removed at age 30 because of heavy bleeding or endometriosis, and that is not normal. And topicals can be a tremendous contributing factor to that problem. Pay attention to what you're putting on your skin. Pay attention to detergents, to scented candles. Anything that has fragrance in it should be looked at with an eye of suspicion. I hope that was helpful. Thank you for joining me today on Keeping Health and Medicine Simplified.